Okay, so get this. We're diving deep into patient satisfaction today, all based on this article. Patient Satisfaction Strategies Boosting Healthcare ROI in 2024. And honestly, I think this is relevant to everyone, right? Whether you work in healthcare, you've ever, sat in a waiting room, this is going to be eye-opening. We're talking crazy stats here. Like, did you know that 81% of patients actually look at online reviews before they even book a doctor's appointment?
Yeah, it's wild, isn't it? It's like we treat picking a doctor like finding a restaurant on Yelp these days. But the stakes are way higher than a bad burrito, obviously.
Mhm.
But here's the thing. This isn't just about hospitals trying to look good online. It's about their bottom line. Higher ratings can mean, like, literally higher profits, more patients, you name it.
It's true. And this article really made me think about how much healthcare is changing, with telemedicine and those like urgent care places popping up everywhere. It's competitive out there.
Oh, absolutely. And
Yeah.
patients have more power than ever,
Yeah.
right? We can go online, do all this research, and we expect a totally different experience than we used to.
100%.
And then you add in this whole value-based care thing.
Oh, right, right.
It's not just about treating people anymore. Hospitals are being judged on how satisfied you are with the
No.
entire experience. Outcomes matter.
Absolutely. So the article gets into all these strategies, 15 of them to be exact, for boosting patient satisfaction. Some of them are pretty out there, I gotta say. Like one that really surprised me was 247 AI assistants. Can you imagine you wake up at like 3 in the morning with the worst sore throat and you don't have to wait for the doctor's office to open? You just chat with a bot and bam, appointment booked.
Sounds pretty futuristic, right? But when you think about it, the technology is almost there. I mean, think about those times you call the doctor's office and you just need a quick refill or have a simple question. And AI could probably handle that, no problem.
Really?
But, and this is a big but, we have to consider the human side of things too.
Right.
24/7 access sounds amazing for patients, but we got to make sure healthcare workers aren't completely burned out trying to keep up.
Yeah, you're preaching to the choir. It's all about balance. But speaking of convenience, there's this whole thing in the article about a 24-hour promise for booking sick appointments.
Really?
Yeah, no more waiting like days or weeks to get in when you feel awful. Could you imagine?
That would be incredible, especially for people who live in rural areas or have trouble accessing healthcare. But I do wonder about the logistics of it all.
Yes.
How can hospitals realistically staff up and handle that kind of demand?
It's not as easy as like flipping a switch,
Right,
right?
exactly.
And this is where things get interesting because the article talks about using AI to make the most of every single person on the healthcare team, especially, nurse practitioners, physician's assistants.
Oh, yeah. I mean, imagine if AI could take care of all that behind-the-scenes stuff.
Yeah.
Like, instantly transcribing patient notes, pre-filling forms, maybe even flagging potential issues in a patient's chart. Suddenly, doctors have more time for what they're best at, actually treating patients. And patients get to spend more face time with someone who can really help.
Okay, so we're talking about AI personalizing the experience, but what about those of us with like chronic illnesses where it's not just a one-time thing?
Right. It gets way more complex when you're dealing with ongoing care.
Exactly.
And that's where the whole personalized care coordination thing comes in. AI could analyze your data, like your entire medical history, medications, everything, and create a care plan that's just for you.
Wow.
You could get automatic reminders for appointments, refills, even personalized health tips based on your specific condition.
It's like having a personal health assistant.
Exactly.
It really is, though, isn't it? Like having someone in your corner, but without having to make small talk, which I appreciate.
Right.
But this article makes it clear it's not about replacing doctors and nurses. It's about giving them like AI superpowers or something. But let's be honest, there are parts of healthcare that are just the worst, even with the best care in the world. The waiting room, am I right?
Oh, the waiting room. Don't even get me started. Those old magazines, the sound of like 1,000 coughs echoing around you.
The worst.
It's enough to make you want to just walk out.
I know.
But what if AI could actually fix that?
Okay, now you've got my attention.
What if it could optimize the staff schedules,
Yeah.
using real-time data? Or what if checking in was as easy as ordering food on your phone?
Now that is something I could get behind. And you know what else stresses everyone out about healthcare?
What's that?
The bills.
Oh, tell me about it.
That feeling of, like, how much is this going to cost me? It's a nightmare.
It is.
But the article actually talks about how AI could make healthcare costs way more transparent.
Really?
Yeah. Imagine if AI could analyze your insurance, look at your treatment plan, and just tell you up front what you might owe.
That would be amazing. No more surprise bills, no more freaking out when you see the mail.
Exactly. And I love that the article isn't just about all the fancy tech stuff. They also talk about good old-fashioned patient education.
Which is so important.
Right. Knowledge is power. When you understand your own health, you're more likely to, take care of yourself, follow your treatment plan, all that good stuff.
Absolutely. And you know what could make learning about your health more engaging?
What?
AI. Think
Yeah.
about it. Interactive symptom checkers, educational materials that are tailored to you.
Okay.
Maybe even like videos or games that make it actually fun to learn about your health.
Okay, I'm listening. I'm all for fun when it comes to healthcare.
Right.
But really, it's about meeting patients where they are. And for people with, more complex needs, the article talks about the importance of building stronger relationships and offering more personalized support.
I like that. Because it really is a journey, especially for those patients, and they need to know they're not alone.
100%.
And AI could help with that too. Like it
Yeah.
could identify those patients and maybe automatically schedule follow-up calls or send them appointment reminders,
Oh, I like that.
even connect them with local support groups or resources, things like that.
That kind of proactive care is amazing. But you know what else would be great? If doctors just had more time to, actually be doctors.
You're telling me.
Mhm.
It seems so obvious, but so many doctors are drowning in paperwork and administrative tasks.
It's true.
AI could be a lifesaver there, like
Yep.
taking notes during appointments, filling out all those endless forms, maybe even doing some basic patient assessments.
So doctors can focus on what matters, right?
Exactly. Listening to their patients, offering compassionate care, making those human connections that are so important.
Because at the end of the day, that's what good healthcare is all about, isn't it? And let's not forget about all the other people who make healthcare run smoothly.
Oh,
The
absolutely.
nurses, the reception staff, everyone.
The unsung heroes.
The article actually made me think about front desk staff because they're often the first and last people you see, right? So a friendly face or a helpful attitude can make a huge difference.
It sets the tone for the whole visit.
Totally. It's about creating a welcoming environment from the moment you walk in.
And that starts with supporting the staff, giving them the training they need, creating a workplace culture that values compassion and patient-centered care.
Hmm.
Because when the staff is happy, the patients are happy.
It really does, Sometimes a little kindness is all it takes. But looking at the big picture, it feels like we're on the verge of something huge with all this, don't you think?
Oh, absolutely. I mean, this article really makes you think about the future of healthcare. Like, are we all going to have robot doctors soon or what?
I know, right? It's kind of exciting and terrifying at the same time.
Right.
But at the end of the day, we want technology to help everyone, right? Patients and providers. So how do we make sure that happens?
That is the question, isn't it? And this is where things get really interesting because what this article is saying is that patient satisfaction is no longer just a nice to have. It's essential for hospitals and clinics to actually survive in this day and age.
That's a big deal.
It is a big deal. It's like we were saying earlier, patient satisfaction is basically the new bottom line in healthcare.
Totally. But it's not just about the money, right? It's about creating a system that actually, I don't know, cares about patients as people.
100%.
It's about meeting their needs, making them feel heard, even exceeding their expectations.
Exactly. And that takes a real shift in mindset, both from healthcare providers and from patients.
Oh, that's a good point.
We have to be open to these new technologies, these advancements, but we can't lose sight of the human element. Technology should be a tool to strengthen those connections, not replace them entirely.
It all comes back to that balance we were talking about. Reading this article, I'm feeling hopeful, but also a little wary. There's so much potential here. But we have to be careful with how we use these tools, right?
100%. And that brings us to a final thought, something for everyone listening to ponder. As AI becomes more and more common in healthcare, who's going to be the driving force behind it? Will it be the hospitals and providers leading the charge, or will it be the patients demanding access to the most, cutting-edge personalized care?
Now, that is an excellent question. It seems like the future of healthcare really depends on both. Technology will play a huge role, of course, but so will our ability to remember that at the heart of it all is human connection, empathy, all those things that make us, well, human. And on that note, I want to thank you for joining us for this deep dive. Until next time, stay curious.